Good morning, Quest employees, and welcome to this month's webinar. Michelle Barnes here from Andrews O'Neill & Lowe. We work with the Quest Group to help administer employee benefits. September is Newborn Screening Awareness Month, so in this month's webinar, we'll be looking at newborn screenings. You're probably wondering, what is a newborn screening? Newborn screening is a state public health service that reaches each of the nearly 4 million babies born in the U.S. each year. It ensures that all babies are screened for certain serious conditions at birth. And for those babies with the conditions, it allows doctors to start treatment before some of the harmful effects happen. Newborn screening is performed soon after the birth of your baby, and in most cases, while you are still in the hospital. All it takes is a few drops of blood and a simple hearing test. Newborn screenings began in the 1960s when scientist Robert Guthrie developed a blood test that could detect whether newborns had the metabolic disorder PKU. Since then, scientists have developed more tests to screen newborns for a variety of severe conditions. Screening tests are currently available for more than 60 disorders. However, there is variability in the number and types of conditions found on each state's newborn screening panel, which is determined by each state public health department. Screening, in general, is a public health service designed to identify individuals in a population who may be at an increased risk for a certain disease. A screening test cannot confirm or rule out a condition. Stated differently, newborn screening is not a diagnostic test. It identifies individuals who may have the condition so that definitive follow-up testing can be offered to determine if the condition is truly present. Today, newborns in most states, the District of Columbia, and Puerto Rico are screened for at least 29 conditions within the first few days after birth. 10 states test for 50 conditions or more. Using a few drops of blood, newborn screenings detect a treatable condition in about 1 out of 300 babies, which is a total of 12,500 cases each year. There are 3 parts to a newborn screening: a heel stick to collect a small sample of blood, pulse oximetry to look at the amount of oxygen in the baby's blood, and a hearing screen. The blood test is generally performed when a baby is 24 to 48 hours old. This timing is important because certain conditions may go undetected if the blood sample is drawn before 24 hours of age. Newborn screening does not confirm if a baby has a condition. If a positive screen is detected, parents will be notified immediately and follow-up testing will be done. Every baby born in the United States will be screened unless a parent decides to opt out for religious reasons. So now let's look at some frequently asked questions about newborn screenings. The first question: my nurse said that my baby needs a PKU test. Is a PKU test the same as a newborn screening? The answer is yes. Some health professionals will use the term PKU as a synonym for newborn screening. The term PKU can be misleading. Every state screens for PKU, a rare metabolic disorder, but there are also many other conditions that are screened for. The next question: will the newborn screening blood test hurt my baby? The answer: most babies experience some brief discomfort from the heel stick, but it heals quickly and leaves no scar. The following suggestions may help make the screening experience more comfortable for you and your baby. Nurse or feed your baby before and after the procedure. Hold the baby during the procedure. Make sure the baby is warm and comfortable during the procedure. Studies show that when mothers or health professionals comfort babies during the heel stick, the babies are less likely to cry. The next question: do parents have to ask for screenings? The answer is no. It is normal hospital procedure to screen every baby regardless of whether the parent asks for it and whether the parent has health insurance. The screening test is normally included in the forms for standard medical procedures that the newborn may need after birth. Parents sign this form upon arrival at the hospital for the birth of their baby. All states require screenings to be performed on newborns, but most will allow parents to refuse for religious purposes. Any decision to decline or refuse testing should first be discussed with a health professional, since newborn screening is designed to protect the health of the baby. Next question: how are screening costs covered? Newborn screening test costs vary by state because individual states finance their newborn screening programs differently. Most states collect a fee for screening, but health insurance and other programs often cover all or part of it. Under the Preventative Services, Medical Mutual of Ohio covers newborn screenings performed in-network, including hearing and sickle cell anemia screenings, with no deductible or copay to the member. Again, my name is Michelle Barnes from Andrews O'Neill & Lowe, and I thank you for taking the time to listen to this month's webinar. I hope you enjoyed listening to the information about newborn screenings. Thanks again.